A question should be easy to answer, but it's not. There are so many things that make it worthwhile.
Seeing people recover, seeing people regain their life, seeing people getting back to doing the things that they love doing, that they want to be doing. Sometimes it can be somebody just saying at the end of the session, that really helped, that was important, I needed to talk about that.
In any part of life, making a difference in someone else's life is essential, and working for the RFDS exposes you to that challenge in different ways, day in, day out.
The Flying Doctor actually guarantees us a quality of life. Our isolation is that we're quite remote. Our access to everyday hospital services and general medical services is extremely poor.
Living where we live, having 4 kids, we had to access a lot of that medical sort of prenatal stuff, and all our kids were looked, and I was looked after by the Flying Doctor before and after the birth of each of them. We live probably 500 kilometres from a town that you can deliver a child. The Flying Doctor introduced a women's health nurse in my time when the children were young, and so that after birth care was also provided by them.
As a parent that lives in a remote area in outback New South Wales, having access to the RFDS and their facilities gives us a sense of confidence in that we know that help is not far away.
People might say that you only have access to a doctor once a month, but that's 12 times a year that someone who wouldn't normally go to a doctor has an opportunity to do so.
The RFDS is the hub of our community, and people really pull together when it comes to raising money for the RFDS because of the high quality service, and it has really affected all of our lives in one way or another.
We've always had a connection with remote and rural communities, and so we want to carry that connection through everything that we do.
How many seats will you have? 1, 2, 3.
It's about bringing us together so that we work together. We understand what the community needs, so we can deliver that health service.
What's that? Oh, the plane. That was a much nicer experience going up there as a visitor rather than as a patient. So thankfully at 11 months old she doesn't remember the experience. I do. It's a wonderful service, particularly for communities out in the west or out anywhere in regional New South Wales who need to access services and to be able to get down there in a timely manner and get seen by the best specialists in Australia. It's of great comfort as a mother out in regional Australia.
We're very grateful to the local communities. You'll notice on the side of the vehicles we've got them badged. The Dubbo Support Group, the Burt community and Lightning Ridge community all contributed significantly with donor funds to help us purchase the vehicles that we use for the patient transfer service. We have a fleet of 6 new ground vehicles based around the Central West and a vehicle in Sydney as well. And we provide an end-to-end service or a door-to-door service where we pick up the patient from wherever they are in the communities and take them to where they need to go, whether it be for an appointment or a scan in Dubbo or for some higher treatment in Sydney. Seeing the patients get to where they need to go, get the care that they need to receive, and then getting them back home again to their families as soon as possible, rather than being 600 kilometres away in a hospital bed on their own. We can help get them back home quicker. We've got the road component and the air component.
I've been working for the RFDS now for close on 30 years, and when we started off we were a very small operation, a single base, 2 aeroplanes, 3 or 4 engineers, a couple of doctors, a couple of nurses, 4 or 5 pilots, and we've now grown into this entity that we now are because there's a need for it. There is a real need for that out there, and the RFDS has grown sufficiently to be able to provide that service. Right from its conception way back in the day to what it does now, and of course we've gone from providing a service to people in the outback just to go and pick people up if they were sick. We now provide a level of preventative medicine, and we're increasing that all the time.
I love working for the RFDS. It makes me very proud to be part of something with such a rich history. It's an Australian icon, and I get a lot of pride just turning up to work every day, helping patients, seeing the crews go out and do what they do best. Yeah, it's really inspiring and I'm proud to be part of it.